Hi, and welcome to THD Medical Hair Rejuvenation Clinic. My name is Toya, and I am your hair loss practitioner. And today we are going to talk about alopecia and its causes and some treatments. So let's just jump right into this thing. So first of all, what is alopecia? A lot of people get this confused and they self-diagnose. Well, I have alopecia, and I see a lot of people come in and say, I have alopecia, and I ask them, do they know what kind they have? No, just alopecia. Well, alopecia is actually just hair loss from the scalp or from all over your body. That's what alopecia is. Now, we break it down into different kinds of alopecia. So just to clarify things, what is alopecia? Alopecia is loss of hair from the scalp and or any body part. It can be caused by genetic factors. It can be caused by hormones, tissue scarring, and other factors. Traction alopecia, that's a form of alopecia where you get braids or you tight ponytails, and you could cause your follicles to die, and you then get bald spots and have alopecia. Some treatments for alopecia includes medication. There are topicals that you could take. There's medicine that you can take internally. You have the surgery. You have laser therapy. You have wigs and different tailored programs to fit your special need. Now, let's get into the types of alopecia. So we have genetic alopecia, androgenetic alopecia, and that's can be genetic. And you have scarring alopecia, you have traction alopecia, autoimmune disease alopecia, and postpartum alopecia. Now, let's just break those down. So let's get into the definitions of the alopecias that I just explained to you, and or its treatments. Okay, so you have autoimmune disorders that cause alopecia, and the most common form is alopecia areata. And this alopecia, you can identify this alopecia by the patchy hair loss that you or your client may have. With this type of alopecia, it can begin at any stage of your life. Kids, babies can get alopecia because it is due to an autoimmune disorder. It usually occurs when you are like high stress, or you have high anxiety, or your nutrition is poor, or you have suffered some type of illness. And then we have another autoimmune disorder form of alopecia is alopecia totalis and universal. I know I didn't say both of those right, but it's alopecia totalis, and then you have alopecia universalis, and these are forms of total hair loss. It causes extreme hair loss all over the face and body. So if you ever encounter anyone who don't have eyebrows or eyelashes, and they don't have any hair, or there's like completely no hair all over, that's a form of alopecia totalis. And that no one really knows what actually brings this type of alopecia on. There have been several studies, ongoing studies, and they really don't know what will bring this type of hair loss on. But they say it's maybe brought on by sensitivities and allergies. It's just simple as that. That's their most recent basic findings. So now that we discussed a little bit about autoimmune disorders, let's talk about how we can